Greetings, everyone. I do hope you are well wherever you're tuning in from. Welcome to the first of 8 series, a discussion about mental health in the Haitian community. My name is Brenda Lormel, and I am the founder and the executive director of the Haitian American Medical Association, also known as HAMA. HAMA started in 2017. HAMA was a long-time dream of mine on how I can utilize my profession and my passion of helping others to then transform into something that will benefit my people, my Haitian people. I am a product of 2 Haitian immigrants from Haiti, and I have the honor of serving in this wonderful organization. Since HAMA's launch in 2017, April 1st to be very exact, HAMA has had the opportunity to serve many folks, Haitian folks, in the Massachusetts area. But as you may see now, we are going live and there may be folks streaming in from all over, and we welcome you. HAMA exists to improve the health literacy of our Haitian American community. This project in particular started in 2018. It's still called our Health Education Tour, where we would take out 5 to 6 months each year, 2018 and 2019, to go into the community, meet our Haitian folks, our lovely Haitian folks where they are, to provide health education in the Haitian Creole language. We would be in the high schools, we would be in the community centers, at our local churches, and we would have a great time. Every year, we would survey our audience to find out what exactly is it that they want to learn. Last year in 2019, the top rated health topic was mental health. And to honor that, we decided to talk about mental health this year. However, this is not how we expected to talk about mental health. We were looking forward to going into the community again. And as you know, COVID-19 has forced us to pivot online to this platform, which we are grateful for because it allows us to continue to serve our community. We welcome you tonight and we ask that you just soak everything in. I want to just make a quick reminder that every Monday night, except for Labor Day week, we will be on every Monday talking about different mental health topics. And every Wednesday, you're gonna call mom, dad, pops, grandma, grandpas, and let them know that the same conversation will be held in the Haitian Creole language here live on Facebook and YouTube. We are grateful that this project has been funded for the last 3 years by the National Network of Library of Medicine, and we are grateful for their partnership in order to help us support and continue to serve our Haitian community. I am beyond thrilled about what's going to happen tonight and the conversation and the learning that we're all in, the healing that we're all going to be able to participate in. When I am not with my amazing team at HAMA, you can find me at Massachusetts General Hospital. I work as the equity nurse practitioner in the cancer center there. I've been there since 2016, and I've had a pleasure of working with colleagues of mine at that institution. I would like to say that I am ready to turn over the floor to our amazing moderator, Christina Michelle. Christina Michelle joined HAMA last year in 2019. She currently serves on the fundraising committee. Christina has been a great addition to our team. Christina graduated with her bachelor's degree in biology from UMass Lowell, and then received her master's degree in biomedical science soon after at Gessinger Medical School. She has the opportunity right now to actually work in manufacturing at Moderna Therapeutics, where she develops lipid nanoparticles, an mRNA drug delivery method to combat COVID-19. Christina currently serves with the Association of Black Women in Dentistry, as she soon has the hopes of pursuing dentistry in her near future. I would like to say, aside from Christina, our team behind the scenes, we have 26 amazing individuals that help throughout our organization through 9 different departments. So you may see us on Instagram, see us on Facebook, but there are 26 amazing individuals that are behind the scenes working hard to improve the health literacy of our Haitian community. So I welcome you, Christina. Thank you for being here and being our amazing moderator for this evening.
Thank you so much for that, Brenda. And welcome everyone who may be watching either right now or later on in the near future. I personally am just so humbled to be sharing a space with all of, these brilliant young minds. And I'm just so excited to see and hear where the conversation leads to this evening. We have 5 great panelists tonight. I would love to pick their brains and to just gain some insight on tonight's topic. We are focusing on trauma in a greater scope of mental health. So without further ado, I would like to introduce each of the panelists one by one, but they will take some time to introduce themselves individually. Tonight we have Anim, Joycian, Dr. Nicole, Vedna, and Chapman Clementina. So we are going to start with Anim first.
Sure. Hi, everyone. My name is Anim. I'm also a product of one Haitian parent. The other parent is Cameroonian, but I'm from Boston, currently residing in Georgia, and I'm a licensed mental health therapist. Specializing. My practice tends to focus on Black women in particular, that Black women coming from the diaspora as well. So understanding the complexities around mental health and physical health and how they relate. And so providing that education as well, because I'm also a clinical health educator.
Awesome. And next up we have Joycian.
Hi, yes. Thank you again, ladies, for having me on your program. I'm excited to be able to share a little bit of what I've learned in the field. My name, again, is Joycian Nicole. I'm a licensed mental health counselor based out of South Florida. I specialize in working with couples, anxiety, and crisis response and trauma, and specifically PTSD. So I'm happy to be here.
Thank you, and we are happy to have you. Next up, I believe we have Dr. Nicole.
Hi, can you hear me?
Yes, we can.
So my name is Dr. Nicole Christian Brathwaite. I am a child and adult psychiatrist, and I specialize in supporting patients with a history of trauma, specifically understanding and supporting people with a history of trauma and racism. And I have a consulting company based out of Boston called Well Minds Consulting. Thank you.
Thank you. Next up, we have Vedna. Okay, next up we have Chapman Clementina.
Good evening. It's great to be here. Thank you. So I am not Haitian. I'm from Honduras, but I have raised 2 Haitian adult children, and I was married to a Haitian. So I hope I'm still welcome here.
Of course.
Because I'm staying. I founded the Peace Institute after my 15-year-old son was murdered. And we're a center of healing, teaching, and learning for families and communities impacted by murder, trauma, grief, and loss. I'm also a chaplain, and I do ministry to survivors of homicide victims, also families whose loved ones are in prison for murder, and focusing really on culturally aspect of how do we begin to heal despite of what's going on. And I'm doing one-on-one counseling to survivors using peace play in urban setting, which is a different modality for healing. And it's great to be here.
Thank you so much for that. Um, our last panelist, Vedna, is actually running a little bit late, but she will be joining us later. But if I could have the remaining 4 panelists all come together, and then we can get the ball rolling with the panel discussion. Thank you so much. So first question that I have for anyone, and before I start, I definitely just want to mention this is a conversation, so please feel free to interject at any time. We also have a chat on the right side of this platform, so if you have any commentary that you would like to state, please feel free to just write it in the box, and I'll take a look at it periodically throughout this discussion. So my first question is, what in your personal opinion is your definition of trauma? How do you personally define trauma? Are there any experiences that you have partaken in that goes along with your definition of trauma?
I can go ahead. I think for me, trauma is sort of a response to any deeply distressing event or situation. So oftentimes when we think of trauma, we can think of like things like PTSD. And definitely that's certainly a form of trauma, but something I think particularly when I think about the Haitian community and I think about our community and unspoken situations that take place, it can be things like sexual abuse when we're younger. It can be like a negative interaction with a parent and something like that, something that inflicts deep distress in the individual. And that individual can carry that for, the rest of their life if they don't address that issue. The other way I think about it as well is a woman who's pregnant carrying a child, when that baby is in utero, mom can be exposed to all this trauma. And unfortunately, trauma can be passed down from generation to generation. And I think that's why it's so important for us to have conversations like this.
Of course, of course.
When I think about trauma, I often think about it as like when something negative happens, but it feels like it's beyond our ability to cope, because the same negative situation can happen to 10 people, but not all 10 people will have a trauma reaction, or if they have a trauma reaction, it's like immediate, but it may not be long-standing, whereas some people, certain experiences hurt them in a way that may not affect other people. And so all of us are different. We all have different levels of life experience and resilience. And unfortunately, what happens is that one bad experience kind of almost primes your body, and then you have another bad experience, and then another bad experience, and then all of a sudden, all of these negative experiences build, and it gets to the point where you can't handle it anymore. And that's kind of, that's essentially the definition of being Black in America. It's like every time you turn on the TV, there's another innocent, beautiful Black body being killed, or you talk to your child and they had another negative experience at school where they felt like they were targeted by a teacher, or every time you're driving and you see a police car, you immediately tense up and you're like, you go into that fight, flight, or freeze. And over time, those experiences, it literally wear us down. There's a theory called the weathering theory that it shows that Black people are physiologically older than white people. And one of the reasons that we're dying earlier is because of the stress of being Black in America. And so that, trauma is just all of those things, although they may be small, they end up growing and becoming a huge burden.
And I think for me, what I would look at it from a personal perspective, I'm from Honduras, Central America, and I came to this country at the age of 10. And I tell you, as I got older, I understood how traumatized I was. One, leaving my culture, coming to what's considered the United States of America, where we said land of the free, home of the brave. And yet when I came, what I realized that I wasn't welcome. Imagine a 10-year-old child. I'm Black, I'm not African American, I'm Spanish, but I don't look like my Latina friends. So what I dealt with was really my African American friends telling me, go back on the banana boat that I came from. And then my Spanish friends are calling me a little piece of burnt toast. And those are terms of endearment. So I think for me, internalizing all of that negative impact from your peers and, going in, shutting down, not wanting to speak English because not wanting to be made fun of. And so for me, that was my really beginning of this thing called trauma. And then I had to realize, well, what do I do and how do I not take that on so that I can be the person that I am today? But that's more from my own personal experience. And not, if I wasn't doing this work, I would not realize and understand that that's what trauma is. It's not always the big event and incidents that we see happen. It's literally the day-to-day things that can happen to us that if they go unaddressed, you know, and again, culturally, we don't talk about certain things that happen. You just leave it in the back and keep on stepping.
Right, right. You know, I think you ladies gave a great examples of definitions of trauma. I want to touch on something that a lot of people don't realize is that there's secondary trauma or vicarious trauma that we can be exposed to from stories that we hear. And I think a lot of that happens in the Haitian community where we might be have adopted fears from our parents based on experiences that they had directly. And we genuinely can develop our own sense of fear from something that we haven't directly experienced, but still exhibit the same physiological responses if we have experienced it ourselves. So very, very great insight, ladies.
A quick follow-up question to that. You know, we experience different things retrospectively. How has, in your opinion, again, your definition of trauma changed throughout your lifetime? So is how you would encompass trauma now, does that differ from the trauma that you experience today, especially in 2020?
Well, I think that like Dr. Nicole stated, everyone experiences an event differently. You could have 100 people that endure what by layman's term we would say is a traumatic event, but everyone will come out traumatized. We'll be able to process through the event, but based on our previous experiences before the event, that is what determines our resiliency, our ability to process, and the resources that we have in the midst of the event happening, and whether we'll be able to really be able to process through that and maybe not come out with a diagnosis of PTSD or post-traumatic stress. So did I answer your question?
Yes. Does anyone have anything else to add?
Well, I think, go ahead.
Oh, sorry. So I think just more recently, over the last couple of years, I realized that like racism is trauma, and I didn't always look at experiencing racism as being traumatic. But then when you if you were to, watch a video, for example, of another young Black man being murdered, I don't watch those anymore because I recognize those are traumatizing for me, and I can feel my body reacting to it. But if you watch these videos and you really sit and reflect, your heart's racing, your muscles are tensing, you probably your blood pressure's probably up, you're very stressed and you're more short with your family members, you're more irritable, and it's that's a trauma reaction. And I don't think I recognized how difficult racism was and how much it impacted me. And I even think, so my son, he's 6 now, and he was 3, a 5-year-old girl in his class. So he was the only Black child in his class, in his daycare, and a white child told him that his brown skin was ugly and he shouldn't wear his red sneakers because it looks so ugly on his brown skin. And to this day, he doesn't like red and he doesn't know why. And so although he doesn't have an actual memory of that event, it stuck with him in a way that's it's a visceral reaction. He's anytime I picks out red shoes, he's like, well, I don't like red shoes. He has no idea why, but that negative experience, as small as it may seem, that impacted him to such a significant degree. And so now that I've been learning and studying about the impacts of racism, so many of us are walking around traumatized, and we have no idea. We don't even recognize it as trauma because often we expect to have to struggle. And it's no, we should not have to struggle through every single day. It should not be so difficult just to exist. Yeah.
And I think what I've learned also, that there's no shame when you talk about trauma. Again, if you're seeing if you're seeing a clinician, if you're seeing someone, again, culturally, there's something wrong with you. And realizing that trauma, there is no shame to that. There's sadness, there's anger, there's denial, there's all of the things that come up, and realizing there's nothing wrong with me. I am traumatized. What I do with it, we're all traumatized. Our entire country is traumatized, especially listening to this president over and over and over again. Talk about trauma. And so I think what I've learned about it, and I'm no longer ashamed to talk about this thing called trauma. It's no longer a secret. It's all out there. What I do with it, and knowing that I can have control over my trauma and how I react. So there's no longer any shame of me saying, yes, I was traumatized. I'm still traumatized because we live in a community that ongoing homicides are happening, and with COVID is happening, and suicide and substance abuse, everything is happening. And so trauma is here, and I no longer see it as anything to be ashamed of. It's a conversation to have, and it's great that this platform is here tonight.
Yeah, I love how you use the word shame, because I feel personally in the Haitian community, or any Caribbean community in general, talking about topics like these tends to be very cliche. So how would you suggest communities of color have these conversations about trauma?
I think to kind of piggyback off my colleagues here, that we have to normalize these sort of conversations. I think first we have to step back and normalize mental health, and that that having mental health issues isn't necessarily mean something is wrong with you, and kind of normalizing and angling the conversation from there. And then we can kind of layer it from there and kind of open up the different sort of avenues that come from there. In terms of my personal experience and just growing up in a Haitian home, and just being a adult now, and being a clinician now and working with people, there is a lot of shame around mental health. There is a lot of fear and stigmatization around what that is, and opening that box, because I think in our community we're so taught to just keep nothing comes out the house, right? Everything anything that happens in the home stays in the home. And so I think that creates a paradox where, people are afraid to talk outside of the home, which is one issue. And then the second issue is that we internalize a lot of things. So when I talk about the connection between physical health and mental health, that I think that's where it lies, right? When we continuously internalize a lot of these issues, I think that's when we see things like hypertension, and we know that runs in our community rampant. So things like that run really rampant. We don't talk about those things. We don't go seek help. And so it just creates this cycle where, both our mental and our physical health are dwindling down. And so I think it's just important for us to normalize these sort of conversations. And, for me, even having a conversation with my mother now as an adult and saying, Ma, I think some of the things that you were displaying when we were younger, that could have been anxiety. And so having those conversations with her, educating her, having that psychoeducation piece, giving her that information that can validate her concerns for her, and also give her the education that she needs to make that connection for herself.
Great. And how would you address trauma in its various stages? Is there one what are the roots of trauma now in this generation that we're living in? Because I personally feel like people could be triggered by the constant uses of social media, what we see on TV, hearing from the radio. How would you address from a physical sense these outlets, I would say, of trauma?
Yeah, I mean, I think everyone's roots look differently. Like a lot of the other colleagues mentioned earlier, everybody will be exposed to different things, but not everybody will respond the same way. I think understanding that, and having an individualized conversation with whomever that is, whether it's my mother, whether it's the lady from down the street, or the lady from the church, and having a conversation with her and curtailing that around her and what her needs are. So it's kind of hard to give a one size fit all for me personally in terms of what to generalize that. But I think having individual conversations and affirming and validating people and making them feel safe, most importantly, because I think one of the things is people are afraid to be judged. People are afraid to seem like, oh, that person or that crazy person. And so when we can create this space where we're holding space for this person, and they feel safe, they feel comfortable, they feel validated, they feel safe, they're able to open up and make those sort of connections for themselves, given if they want to go the therapeutic route.
And I think what you guys are doing here, HAMA is that perfect venue to be able to as professionals not to shy away from it, to really bring it forth, and to do that education. And I think also helping others to know the different signs. There's the emotional signs: sadness, fear, anger, denial. That's a part of trauma. And then that may lead to nightmares, to sweating, difficulty with relationships. I'll tell you, what I didn't realize after my son was killed. There's a research that tells you 75 to 80% of marriages end up in divorce or separation. Well, I never thought I would have been one of those. So for me, my trauma added, because now I had to deal with the death of my marriage. And so relationships break up, and then some physical symptoms. I carry my stress right here. My trauma is right here. And I didn't realize and understand, why am I so tense? But I was taking on everybody else's stuff and not understanding, no, you need to find a way of walking away from it. And then once I realized this thing called PTSD, if we don't address trauma, I realized I was a walking basket case of PTSD. But then I had to realize there's nothing wrong with me. It's again this thing called trauma, and no one is helping to understand what that is. All right, there's nothing wrong with me. What is it that I do? And as it was said already, what are the venues? What are the avenues? What is it that's out there that can help me, whether it's culturally, whether it's spiritually, or whether it's emotionally? What's out there that can help me, and who else is out there that's dealing with the same thing that I am? And then again, the way you have this panel, how do we collectively now have the conversation that it's not only when it happens to white people and then we respond in a way? It's happening. How do we also make sure that we're responding that's culturally appropriate?
I follow-up question. In addressing the roots of trauma, Chapman Clementina, how do you think you use your platform to reach out to, youth and young adults? Because I know there are multiple aspects in order to address trauma, and spirituality is one of them. So how do you use your personal platform?
Different ways. We listen to whoever the person is that's in front of them. A lot of times what I've learned is each of us, we all have the innate ability within ourselves to do what we need to do to heal. So really just providing a safe and neutral space for someone to be able to talk whatever is on their heart. Many times people can't talk, so we use a modality called peace play in urban setting, playing in the sand. Sand has a way to motivate and to stimulate our brains. And then miniatures, what's in the world, what's out of the world, and what can be in the world, helping the individual to become the architect of our own inner healing. We know play therapy works. I'm not a therapist, but yet this was a modality that I've learned, that I was trained in, and it's something bringing back out into the community so that the community and individuals, we can be the architects of our own inner healing, especially now during COVID, social distancing, going to a therapist. And again, finding therapists that look like you, that are culturally responsive, has not been easy. And so that's one way of doing it. Also within the schools, we've developed what's called the peace curriculum. And it was actually the first curriculum in this country that incorporated the teaching of loss and grief as part of our children's social skills. Mind you, this was in 1994. Now they call it social emotional learning. But this was developed in 1994. And so looking at different ways from children to families and to communities. And then there's a project that we have, the Peace of God. How do we look at spirituality, not religion, spirituality, and how do we trust, and how do we go deep in and find the courage to really begin to heal? If we're looking, whether it's scripture, whether it's meditation, whether it's motivation, but instead of focusing on what I'm not, shift that mindset to who I am and what I can be despite of my circumstances. So I have now become the architect of my own inner healing. And that's how we work with families, not in what's wrong with you and medicating you. If you need medication, you need medication, but really empowering you to go through the valley of the shadow of death and then to come out on the other side whenever you're ready. And there's no time frame.
Right.
That's one of the things. There's really no time frame. It's a journey. There's the destination is whenever you feel. 26 years later, my son has been murdered. I'm still healing. I'm still on that journey because things will retrigger. You know, my grandson, when my daughter got married, when my youngest son is now older than my oldest son when he was killed, all of those things are retriggered. So it's really being gentle with self. And what I do, what works for me, is what I provide to my clients, and they choose whatever works for them. And what doesn't work for them, okay, no judgment.
Awesome. Thank you for that. And I just want to open the floor and give anyone else a chance to answer how they utilize your platforms in order to address the issue of trauma.
So I think one thing often is that mental health in general, and particularly with trauma, we often feel alone. And that's kind of what trauma does. It makes you feel isolated. It makes you feel like you have no control over your life, over your world. And then particularly, you know, COVID in general, and then with this national conversation on racism, like we feel like nothing is in our control. We can't control how we get to work. We can't control what our kids are going to do for school. And so, you know, so much of that, it makes it feel like there, as a lot of the members of the panel said, like, it makes you feel so isolated, and it makes you feel like burdened and stigmatized. And I struggled from postpartum depression, severe postpartum depression. And for months, I didn't tell anyone because here I am, a full-blown psychiatrist, and I was afraid to talk about the fact that I was having unsafe thoughts and that I thought I was the worst mother in the world, and that I truly, truly believed my family would be better off without me. And it was finally, I got to the point where it was almost like that other part of my brain woke up, and it's like, wait, you need to ask for help. Like, you're not functioning and you need to ask for help. And then I started talking to people, and I called my mom and I called my cousins and my aunts, and they're like, oh yeah, I went through that too. And I'm like, wait a minute, y'all all went through this, and nobody wanted to give me a heads up. Nobody wanted to tell me that this isn't something I have to do by myself. And then it's like, that's when I realized, I'm like, we have to talk about this, because there are so many of us who are really struggling and are under the assumption that we are by ourselves. And just simply knowing that you have a community that can support you and that could say, you know what, I completely understand that feeling of believing that this world is better off without you, but let me just explain to you it's not, and you will get through this, and I can support you in getting through this. And so a lot of the treatment that I provide is treatment that worked for me. So, you know, like using meditation, using mindfulness, being very intentional about what I let into my mind, body, and spirit. Like I said, I don't watch the news. I watch TV shows that make me laugh and that have no basis in reality. And that is all I can watch, because I deal with so much of holding other people's pain. And my off time, I have to be able to diffuse that, because then I also recognize, like, I snapped at my 6-year-old for being 6. So it means I got to take a step back because something is not right with me. But that takes a lot of time and reflection and work. And I think if we're all able to have that conversation, then it normalizes it. But also, like, you don't need to, and I have to say this so many times, you don't need to suffer. We are already suffering so much. You don't need to suffer. You don't need to suffer alone. And there is support out there. Like, there certainly is a shortage of psychiatrists and therapists specifically for kids, but you can also create a support group amongst your family and friends. Like, your kid isn't the only kid that's struggling. So there are other children who could use that support. And it's amazing. I don't think we give kids enough credit. They're so smart and they're so resilient. And it's amazing. Like, you'll see your kid giving another friend advice, and you're like, wait a minute, that's what I told him. So maybe it is sticking a little bit. And so we can create communities of support even outside of what exists in the mainstream.
Excellent. I think I wanted to ask a question myself. I think we tend to advise people to, you know, constantly have these conversations, seek out for help. But how does someone initiate the conversation? How does someone find these resources, you know, in order to combat trauma? Where would someone even start?
They're actually local to Massachusetts. There's a therapist named Charmaine Jackman. She created a website called InnoPsych. It's INNOPSYCH, I think .com. And she's a psychologist here, Black psychologist. And she created this website called InnoPsych that has a list of therapists and mental health providers and psychiatrists from all over the country of color. And so it's, Black, Latino, different languages, LGBTQ, but specifically who focuses on underserved groups. So that's one place to start. There are other websites like Therapy for Black Girls, Therapy for Black Boys, Psychology Today. You can search based on your interest. So if you fit a certain population or even insurance, that's another option. There are even apps that are directed towards people of color. So there's an app called the Liberation app. And it's a meditation and mindfulness app that all of the people that direct the mindfulness activities are all people of color. And so many of them also have their own practices, and they do also offer resources to that app. So it's hard, but it is possible to find support.
I would also add just real quickly, checking in with your insurance. So with your insurance, you're already paying that premium. So you literally give them a call and specifically state that you want a Black provider. There's nothing wrong with doing that. I think often people are just feel like there's something wrong with doing that. There's nothing wrong with but asking for, a list of Black providers that are within your network. Given if you have a PPO or HMO, depending how your plan works, but asking specifically to your insurance to get that list so that they can cover the cost, essentially. And if you have the other thing is your PCP, your primary care physician, or your pediatrician. That's a direct, way to get a referral for a therapist. Hopefully, there's one in network. If not, I'm sure they're aware or know of someone. They may not have a great list of them, but definitely a good way to get the foot into the door, get the conversation rolling. Because a lot of primary cares are integrating with mental health. So I'm a behavioral health specialist, and so we've integrated medical with behavioral health, essentially. So when mental health concerns come up during your medical visit, someone like me will come in, your doctor will give me a call, I come in, I meet with you there. That way we capture that client right there in that moment, rather than letting time lapse, rather than letting you go and waiting for the referral or waiting weeks and weeks to give you a call. We can capture you in that moment and kind of have that conversation and build that relationship in that, in real time. So many said, there are a lot of options, and it's hard to not get overwhelmed with everything. But for me, kind of just start what makes sense or what's the easiest. So if you're always seeing your primary care, or you're always, giving the insurance a call, why not just start there?
Awesome.
Right.
Awesome.
And a couple of things now. Right now during COVID, a lot of the copays are being waived for telehealth. So
yes,
we widened our network of access to people across the country. The other part is in narrowing down that search. If you feel like you are suffering with PTSD or what we'd say is a capital T trauma, like a big traumatic event, you can narrow it down to a person of color that's trauma trained, and insurance companies have that narrowed down, because that's very important. Because oftentimes we might go to someone that is very trained in one area, but it's harmful if they're not trained in what we need, because then we're going, and we're not seeing relief. So that's very important to make sure that if you feel like you need relief from PTSD, which is hijacking your brain and causing you to go back to a feeling that's not existing today, then that's very important that you see someone that's trauma trained.
And I think we have to normalize it. I think I always say, if I'm doing good, thank my therapist. If I'm not, oh, well, I need another therapist. I think we have to sorry. Again, this is a great platform. How do we begin to normalize it without having that shame and stigma? I think churches are another way. A lot of churches, especially Black churches, they're professionals in the Black churches. They will have kind of some resources, out there. A lot of churches are also having bereavement ministries. So I think finding a way of also making trauma a part of that, because grief is one thing, but then what happens when death knocks at your door? all those things that, were in the back of our mind will then come out. So I think finding ways, even the bereavement ministries in the church is a way of, again, to be able to talk about the word trauma and finding support to deal with traumatic events, unresolved grief.
Thank you. I just wanted to take a quick pause and introduce Vedna. Welcome. I don't know if you want to take 30 seconds to a minute to introduce yourself, what brings you here this evening. We're so lucky to have you.
Oh, thank you. Yes, my name is Vedna Lacombe Haywood. I'm coming from like a different background in a sense. I've been a trauma nurse for probably over 22 years. And I also actually do bereavement work as well. I'm a bereavement specialist. And I also co-lead loss groups specific to families who have had loss, from perinatal loss to early childhood loss. And I've been doing that for almost, I guess, a decade now. And got into the work actually after a loss that I had. So went on and became trained in thanatology, which is the study of loss and grief. And I continue to do that work along with doing trauma nursing, which is more critical care nursing, and dealing with patients who have are in their acute care phase of a traumatic injury. So thank you for having me.
Thank you. And thank you for the introduction. To go on to our next question, can trauma be prevented in any way? And if so, how? Okay.
Go ahead.
No, I was just gonna add on, are there any preventative steps that one could take? Yeah.
Okay.
Go ahead.
Well, I don't know if it can be prevented. Trauma, I mean, given birth is a traumatic event. Giving birth is a traumatic event. So from again, maybe research is out there, but from a humanistic perspective, I don't think trauma can be prevented. I believe what we do with that trauma, once we are aware that something bad happened, I'm going to look, trauma can happen whether it's a child's pet that died. That's a traumatic event for that child. So I really don't think it can be prevented. I do believe that we as a society must begin to acknowledge, to embrace, and as everyone here has talked, we all have the tools. We just need to, I think the invitation now, especially now that this panel is happening, the invitation now is, how do we then embrace? How do we not push people away? How do we not say that, oh, it's Joey, he's just crazy, or that's Uncle John, he's just crazy. There's steps and there are resources that we can put in place so that the PTSD and everything else that comes with trauma, that's a normal reaction to an abnormal situation. So for me personally, I don't think, I'm going to be 60 years in a couple of weeks, and I'm still dealing with issues of unresolved trauma. So I don't think it can be prevented.
Yeah. I agree with you. I do believe that there are resiliency factors that we can build in individuals and communities. So I'm a trained clinical social worker, and our work is rooted in the person in the environment. However, Dr. Nicole, you alluded to this idea, which I 100% agree with. Being Black in America can be traumatic within itself. So unfortunately for our people, it's different from everybody else, right? So while we do have these resiliency factors, and when I say resiliency factors, essentially putting resources in place, building coping skills, building that resilience for our people. But when we have to rely so heavily on around resiliency, I think it does something to us. And I think that makes us at some point more prone to trauma. So I do think we can build coping skills. Unfortunately, we can do these things, but I do think as Black people, as Caribbean people, as Black women, unfortunately, we are still at a higher risk of trauma because this world wasn't designed for us necessarily, unfortunately, and it's running how it should, right? It's operating and keeping us in some ways, in many ways, and experiencing a lot of these traumas, unfortunately. So I hate to seem so negative, but I do believe we can build resiliency. But if we rely too heavily on that, I do think it puts us in a place where we become more overly exposed to some traumas in some ways.
Right, right.
I'm sorry,
Okay.
please.
I just want to say, I think so the event eliciting the response can't necessarily be prevented, but I think our exposure or our post-traumatic stress, secondary to that event, can be either prevented or lessened. Like you mentioned, if we actually have some things that are in place. I think there are many factors to be taken into account. And like you mentioned, in terms of the individual, our situation, like cultural factors, environmental factors, our community, what existed prior to that event happening. That now has predisposed you to now post-traumatic stress because of the event. I think trauma can be managed with effective interventions, but in terms of the event itself, no, I don't think it can be prevented. The response to that event, I think if there are some things that are in place, then yes, we can kind of lessen, the amount or how we perceive.
Mm-hmm.
Agreed.
So I do think some traumas can be prevented. So I think it depends on what the trauma is. So racial trauma can be prevented, but it's not on us. It's on white people to change the way society exists so that we're not victim to racism. So, that everybody is about Black Lives Matter and everybody's talking about it. And I'm just kind of waiting to see if that actually makes tangible change. Hopefully it does. Hopefully, elections change things and systems change and the structural racism that changes. But, so a lot of the trauma that people of color experience are not our doing. It's the doing of the society and, white supremacy and the racism that's embedded in our country. That can change over time. We can also be discerning about what we allow ourselves to be exposed to. So again, I cannot emphasize enough, you do not have to watch videos of people being murdered. You can set settings on your social media so that videos don't automatically play when you scroll through. You can choose which articles to read that may or may not have the video, because looking at that or watching a 24-hour news cycle where they're showing these videos over and over again is traumatizing and will cause you to re-experience prior traumas. And so you can avoid that. You can avoid, if Donald Trump is triggering to you, you don't listen to him. And so there are certain things that you can do to try to minimize re-traumatization or worsening your underlying trauma. And then, there are certain traumas that if as communities we're more willing to talk about them, we can prevent them. We all know that we've had family members, we've had friends who had that one family member who inappropriately touched children in the family. And people knew about it, but no one talked about it. And so if we're willing and able to have these conversations, then that trauma can be prevented for future generations. Or, there's a trauma that comes with immigration and having to go through that process and acculturation. And if we're able to support families and, being willing to accept who they are and the culture that they bring, that trauma doesn't have to happen. So there are ways to hopefully prevent some of these traumas. Some things we can do on an individual level, but there are things on a community level that we can do, but certainly on a societal level that if we're willing to change, there's a lot of pain that can be prevented.
Awesome. Does anyone else have anything to add?
Yes. I want to piggyback on some things that some of the ladies have said. So Dr. Vincent Folletti and Dr. Ande, through the conjunction with the CDC, developed a 10-item scoring system called the ACE score. And so the ACE stands for your adverse childhood experiences. And so you guys have kind of touched on this a little bit already. And these are things that we were predisposed to before the age of 18 that they found had a direct relation to our physical health later on. And so in preventing trauma moving forward as family members, as community members, if we can reduce the incidences of some of these items on the score, such as exposure to an alcoholic parent or a parent that has substance abuse issues, the way we speak to our kids, the way that we might speak down to our kids, a divorce in marriages, in the home, the more factors that kids have, the higher they might be predisposed to not being able to work through trauma later on in life, a traumatic event. So we can reduce the extent, like Brendan was saying too, to which an event affects us by reducing some of these factors.
Great. What, in your personal opinion, are the lingering effects of trauma? Are there specific effects that you see that are reoccurring within a specific demographic? Can you pinpoint a certain demographic that you personally think tends to show like the lingering effects of trauma more than others?
From a medical standpoint, there's actually a lot of lingering effects from trauma. As I kind of mentioned before, there's a couple there. So from the, as Joyce mentioned, from the adverse childhood experience study, and then there was another study, the Philadelphia study, that looked at like community trauma, like living in communities with violence. So people who, for example, had 4 or more ACEs had a significantly higher risk of having teenage pregnancy, of having prenatal loss, of dealing with substance abuse problems, of 6 or more ACEs, your risk of dying 20 years earlier is much greater. And so traumas, so toxic stress, which is like stress that's overwhelming that our bodies can't handle, is what leads to trauma. And then toxic stress leads to chronic inflammation. And chronic inflammation leads to chronic disease, and then chronic disease leads to early death. And so it's all very connected. So from a medical standpoint, the greater the number of traumas, the greater the risk is that you will deal with more complex medical problems. And so Black people in particular are at greater risk of having more trauma. So PTSD is the most common anxiety disorder in Black Americans. And that's, again, because of all the stuff we have to deal with, and that we also happen to be at greater risk for obesity, diabetes, and heart disease. Also, all of these things that are putting us at greater risk of dying from COVID. And they're all very connected to traumatic experiences. And the more trauma you have, the greater the risk. It even increases the risk of breast cancer. So the number of traumas, basically any chronic disease that you can think of, or even mental health problems, or even, basically almost any negative experience you can think of that you can have later in life, your risk is greater, the greater number of traumas you've had. And so when we think about resilience factors or things we can do to decrease the impact of trauma, things like prayer and having faith and having a religious background, or mindfulness or meditation or going to therapy, these are all things that we can do to try to mitigate or decrease what trauma is doing to our bodies that could have these long-term consequences.
Absolutely. I think she hit it on the head with everything. And one that jumped out to me was just in terms of birth outcomes. When we think about birth outcomes and Black women and who has the least favorable birth outcomes, it happens to be Black women. When we think about who's heavily traumatized, they are Black women. And then when you think about the birth outcomes and the low birth weight and what that leads to, it's just literally a cycle. So unfortunately, it just lingers from generation to generation to generation. Unless we interrupt it by we got to start by having conversations like this. We have to start by, creating safe spaces for people, especially our Black women. That's why my practice focuses on Black women, that we can't begin to build those resiliency factors. We can't begin to build those coping skills. We can't begin to build that, safe community for our people unless, we kind of just start it here by having these conversations and normalizing what the experience is.
That's good.
And I just want to piggyback on that as well. When you maternal health. There was a study, I think, that was done late 90s, early 2000s, specifically in Boston, because there was a phenomenon that was happening where Black women were either dying in their first year or their children were dying in the first year. And the question was, how was this happening in a city that has so many medical institutions? Like, why was this phenomenon happening? And what they did find was it was linked to stressors. It was linked to the amount of stressors that these women were going through, whether that is just regular social stressors, socioeconomic stressors, whatever. These were the links that were causing these low birth weights, that were causing these, deaths, that were causing, the hypertension or what other complications that they had with their pregnancies. So yes, I do agree in that sense. In terms of like just, the stressors that we have. Also to kind of label, I think some people don't. So like in terms of like PTSD and what that looks like, because this is what I find sometimes with some of the families that come in and how they're not recognizing their PTSD and knowing that, the anxiety that they didn't have before or that increased amount that now that they are exhibiting, that's PTSD. The difficulty remembering and concentrating, irritability, their preoccupation. I find a lot of times with my couples that, they're reliving this thing over and over and over again. And that's, PTSD. So it's actually recognizing some of what this symptomology is. I think sometimes people just say, oh, this is just, something, they're not linking that traumatic event to the anxiety they may feel just driving down this, where you could be driving in traffic and this anxiety that you never had before, you now are exhibiting, or work stress that you never had before, you're now exhibiting. So it's being able to recognize some of the factors that do pop up after you've had like a traumatic event, like truly like labeling them before they get to these chronic illnesses or whichever.
Mm-hmm.
Right.
And how do you think, ideologies, that plays in the Black community, such as this superhero syndrome, plays into like the various steps that trauma may take into effect?
I think it gets masked. I think it's easy to cover it. And I think, Vita, you mentioned something and it clicks for me. But I think it's important for us too, as clinicians or providers, physicians, that we keep an open sort of mind in that with the cultural piece, right? Our clients, and I'm thinking about my Haitian clients because I'm a Haitian woman, she may not come out and say that, I'm anxious. So like she may say it in a different way. So it's important for us to kind of be attuned to kind of, or just be mindful of kind of the conversations that we're having with our clients and keep an open mind, because I think we're so heavily trained in our white westernized DSM books, and it doesn't always take into account, our cultural pieces or some of the things that may come out in conversation. So it's so easy to mask what they're going through with, just day-to-day life because of that cultural piece. So I think it's important for us as providers to make sure that, we're there with them and we can pick up those sort of things.
Mm-hmm.
And I think I like your question again, that kind of superhero, I think, again, I want to go personally. For me, when my son was killed, it's people looked at us. And again, this is when I was married, and we were this perfect couple. We were teaching and we were helping people to heal, yet there was really no one out there to sit us down and to say, do you know that when your child dies, 75% of marriages end up in divorce? What are you doing? How are you doing? What support do you need?
Mm-hmm.
Because it seemed like we didn't need any type of support. And how can I say I need support when I'm the one out there, the professional, the one that people are looking to for answer? And so I think that's something important that we really have to, or we should not be putting a lot of pressure on Black women, on immigrant women, because we make things happen. And I think finding ways of, I don't like to use the word hate, but this word You're such a strong person. I
Mm.
don't know how you do it. Don't say that. That's a statement that okay, then it means I have to be strong because that's how people are looking at me. So I think it's even in our language. How do we not put labels? How do we not put this superhero label on someone who has overcome the obstacles? How do we hear from them? And again, how can I tell my story of death and grief and trauma and journey, but then don't put a label that I'm such a strong Black woman because I'm still going through that journey. It hasn't ended yet. I've
Right.
just learned with mindfulness and meditation and prayer, and I'm going to use the word how to control that part of me and not let that part of me, my trauma control me. So I think it's even with us, how do we make sure we name those and we tell someone, stop me, you're moving too fast. Oh yeah, I forgot to drink water today.
Right. Right.
Right.
I think we can redefine
I
strong
think,
means. Sorry. I think we can redefine what strong means. I tell my people, strong means that you're going to cry in the middle of the grocery store when the tears come.
Yeah.
You let them fall, and you allow yourself to walk and pass through that wave.
Yeah.
Strong means exactly what you're doing, Tina. Strong means that you're learning to feel and deal so you can heal. I actually got that from another therapist. All right.
Do you think vulnerability can go hand in hand with experiencing a traumatic event?
You took the word out of my mouth, the vulnerability word. There is power in vulnerability that I think we kind of underestimate. That is one of the things that I continue to be in awe with, like when I have couples that come in as opposed to the mother, or when there are couples that come in after the loss of their children. To me, there's for lack of a better word, there's beauty in that vulnerability because there's an acknowledgement that we have both gone through this, that we are willing to come forward and actually, say that we've gone through this and be open in that space, with you. So I think vulnerability allows for repair. I think, that's a difficulty that we have. We do play this superhero syndrome that allows us to kind of compartmentalize that trauma, but we're not dealing with it. It's packaged away somewhere. And so in that vulnerable space, it allows you to kind of acknowledge that this has happened and be able to, feel, deal, heal. And so I remember, like, even in my space, doing trauma for X amount of years, when I had my loss, I put it away. I just literally put it in a little box and, almost disassociated with it. But trauma has a way of finding itself someplace if you're not dealing with it. It pops up in other spaces. And so I had to learn actually to cry and be vulnerable about a loss that I incurred. And so, it's there's a difficulty. I think we as a people are known to just keep on trotting on. We've been doing it for centuries, but in order for us to repair and kind of break some of those generational curses, like those generational traumas, we have to learn how to deal with it and be upfront with it and say, this has happened and I need help. And actually, get help and go forward with this.
Yeah. When we think about like what's happened, with Black Lives Matter, and even though we've been through this round before, something was different this time where other voices were speaking up and giving us a little bit of a break, for Pete's sakes, because yes, we are triggered, as some of you ladies have said, by the videos that we're seeing and the images. And again, this is happening again, but I feel like this time we were given, not that we needed the validation, but it was out there that we needed to take a step back and to be able to walk through it ourselves and not have to explain it, to other people and try to, be able to just kind of deal with it ourselves. So I think it's important that as you're walking through something that is traumatic for you, that you allow yourself the space to do what you need to do. You allow yourself to be vulnerable, to say that I'm not feeling okay today. I don't care if it's been 3 months since this event happened. I'm not feeling okay today. And that vulnerability will reduce the shame that tends to come in the Caribbean communities that we're not strong.
Mm-hmm.
I reject that former definition of strong. Strong is feeling and dealing so we can heal.
Thank you for that. I'm actually going to ask one last question to you all, and then I'll just open the floor for any last minute remarks. From your experience being Haitian or working with Haitian or Haitian American populations, what is one prioritized piece of advice that you would give to our community?
Okay, I'll jump in. Okay, deal. Like let's try to deal with our issues. There's, we're a people of strength in a positive sense, a people of freedom, and a people of legacy. And what legacy are we going to choose to pass on? And so when we think about what do I want to pass on to the next generation, what does that look like? And what do I need in order to be able to communicate that freely? Am I bringing bondage from the past, or am I choosing to let that go so I can walk into a better future and for our kids and our kids' kids?
So I was actually going to say something similar, but I would say, obviously work on ourselves, but really work on supporting the next generation. So talking to your children about mental health, talking to your children about just the struggles of every day, and that it is okay to feel pain. It is okay to feel anger. How can we express your anger in a way that feels safe for you? How can we have a conversation? And, again, like listening to kids, hearing kids, not minimizing kids. And, with the COVID and the coronavirus, with so many of our kids not being able to go back to school or having missed school, or, realistically, kids going to college, they're going to be home soon. Kids are grieving a tremendous loss, and we really need to be present for our kids, not to minimize their loss, not to minimize their pain. What we're dealing with every day may feel so overwhelming. So a kid crying about not having prom may seem small, but to them that was major. And so, giving our kids the floor, giving them an opportunity to use their voice, even using something called reflective listening. So not listening to respond, but listening to understand, listening to hear. So when our kids are talking to us, they're not necessarily looking for a solution. They're not looking for us to give them an answer. They're just looking for us to say, I hear you, I understand you. So reflective listening is essentially like letting someone talk and then summarizing what they told you so that they know that you heard them. And it's amazing how powerful that is, especially for kids when they so often don't feel heard, but simply saying, okay, so it sounds like what you're telling me is that you're this, and this happened. And then you identify an emotion to help build a kid's emotional language. And it sounds like you're really frustrated because of it. And if you're wrong, and kids will correct you, but at least you've opened the floor and you're starting to normalize the conversation of discussing emotion, discussing pain, and letting that child know that you are available. There's no judgment. And if they need to come to you when they're struggling, they can.
I love that. I would just say, sorry. God, I had a thought and it just escaped me. You go ahead.
Okay. I just want to just piggyback on what the doctor said, not to marginalize your child, like when you're talking about children. I have a 7-year-old, and not to marginalize their insight. I think at times, especially, and I don't know why. Okay, let me see. All right. It's not to marginalize them. I think a lot of times, especially in our culture, there's a tendency for us to see age, and with young children, we don't see them as being insightful. We don't see them as, having some sense of competence. And so I think in that, as she mentioned, is just understanding that your children have feelings, that they are insightful. I am often amazed at what comes out of my 7-year-old's mouth, and how in tune he is with his feelings. And so instead of marginalizing that, I do, for me, we engage in conversation, and then work to kind of like, just work through that. So I think, just growing up in this culture, there is just having that acknowledgement of, as opposed to either debasing or ignoring. So.
Yeah, I think the other part is, I'm echoing too.
Can we all mute, if possible, please? Hopefully that works.
Okay. Yeah, that sounds better. So I think the other part is because this generation is completely different than the generation before and the generation before and the generation before. I tell people I think my generation is where we failed, in my generation, because we wanted to be friends with our kids and we all that. I think there's a way in doing, and again, I go back to this platform. There's a way of still, as we're doing this, educating the elders, educating the men, because when a child wants to express, what do we say? What, you're educated now and you're disrespecting me. So there's still that part there that I think we need to look and we need to balance, because the elders, their culture, the way they was raised, and then you look at the men. The men are a type that they're not dealing with their emotions, especially if you have young boys that want to talk about their feelings, and that there's elder or that father that's there that is telling that child, stop being a girl, you got to be a man, and it's knocking the feelings and the emotions of that child. So I think as you continue to do this, there has to be a way of engaging the elders, the seniors that may not have had the degrees that, the people that you guys have right now. And then your children, again, going to talk to their grandparents. It's the playing fields are not level, that instead of the support from that elder to that child, it may shut that child down again and will not be able to express. And, I'm going to talk it again from being married to a Haitian man. I just wish that the Haitian community had really looked at him and sat him down and shared about the grief and the trauma and the pain as a father. Because men are not taught to grieve, to cry, to express. If they don't have the answers and if they can't fix it, then they run from something. So I think for me is fine, again, raising 2 Haitian children, young adults, they're a little better than they were. I think if I didn't have the support, and again, that willingness to listen to their emotions and to their feelings, and then taking their recommendations as grieving children and creating a workbook, always in my heart, a workbook for grieving children that came from their own perspective. But I just want to make sure, as you guys continue to do this, how do you pull the Haitian men into this thing called trauma, into healing, because so that they can even stop that and provide a space, and maybe even beginning to have healing circles, just conversations. Let's just talk about history and let's just learn from you. And then how do we again provide a safe space where our young boys are able to talk about the pain and the grief, and that cycle, that retaliatory cycle can stop because we have provided a safe space. I mean, we're women, and as women, we just let it all hang out. And sometimes that gets us in trouble. But how do we, what is the phase to bring the men in to this, so that it's okay for them to also cry, that they don't always have to be the strong Black man to keep the family going, that they can say, I don't have the answer, I don't know, I need help. That would be my recommendation.
And then I would just add the piece about for our Haitian women, and this can be applicable to all Caribbean women, all women of the diaspora, is just to take care of ourselves. We wear many hats. We're mothers, we're wives, we're girlfriends, fiancés, we're all these type of things, and we give so much of ourselves to whatever we do, whether it's our job or the relationships or whatever have you, and we often neglect ourselves or we put ourselves last. And I think while we have so many things to do, it's important that we take care of ourselves so that we can continue showing up and being sort of being useful at that point, right? Because there's no point in showing up if you're drained, you're tired. Like at what point, what do you serve for those people? I mean, granted, people appreciate your presence, but like we have to normalize taking care of ourselves. We have to normalize taking time outs and, you know, practicing self-care, especially for Haitian women, because they don't do that. Like I saw my mother come from work, go cook, serve dinner, like, you know, make sure we took a bath, do our hair, and then go to sleep and do it all over again. And she never took time to take care of herself. And, you know, now she's like tired and body's hurting all the time. But we have to normalize taking care of ourselves and doing things for ourselves and putting ourselves first at some point, even if it's a day, an hour, a minute, whatever. Just build that into our routines and start to normalize that. Start to see it so our daughters can see that, our sons can see that. They can see us, you know, prioritizing our needs as well as our families and having healthy balance, right? And so that's what it's all about. So if we see it with our mothers, it all starts at home, right? So if we see our mothers practicing, let them be the models for our future generations to come.
Sorry, my mic was on mute. I would like to thank all of you for taking the time out of your evening to join us, both on Facebook Live and on YouTube. I know a lot of information was shared tonight, so I'm just going to open the floor and give you all a chance to express any final remarks that you may have, any you know, lingering ideas that you wanted to share, any resources that you wanted to give out to our online community, any takeaways that you think would be helpful.
I on my website, wellmindsconsulting.com, under resources, I have a couple handouts that I created. One is it's called COVID-19. So it's things that we can do to help support ourselves and support our children dealing with the difficulties around COVID-19. And there are a ton of resources, including a number of suicide hotlines and crisis hotlines that can receive calls or text 24/7. There's also a list of like mindfulness and meditation activities that we can do both with ourselves and with our kids. And a lot of them are utilizing like 5 senses, because often when we're overwhelmed, we can't talk, but we can smell, we can taste, we can feel. And sometimes that can be enough to help ground us or bring us back down so that we can get to the point where we can process and talk. And then also I have a list of resources for people who have experienced racism, and then also for people who want to learn more about becoming anti-racist.
Excellent.
Well, if anyone's interested in kind of following up with me, I'm online everywhere at Anim, all one word. And also developing my mental health program, which is good, will be an online mental health platform that will be open to everyone and providing different tools and different modalities for healing. So not only will therapy doesn't necessarily have to mean talk therapy. It could mean physical therapy, it could mean movement, it could mean art, it can mean all these sort of things. So therapy over silence. I have my shirt on. You can find us online as well. Find us on Instagram. The platform will be launching soon. Stay in tune with everything going on via Instagram for right now. Instagram and Facebook.
Yes, and you can find me as well at Illuminating Hope. Okay, yes. You can find me as well on illuminatinghope.org and on Instagram at illuminating_hope. And I'm based out of South Florida, but if you are struggling with PTSD and you would like me to connect you or just put you in the right direction of a type of treatment that you would be highly beneficial, I can do that for you. And also, before I go, I just wanted to say to Clementina regarding your question with addressing the men, just remember you are a pioneer in the programs that are in the schools today that are helping young men be able to work through their feelings. So thank you. Thank you.
Thank you. I think for me, you can go on our website, ldbpeaceinstitute.org. There are a few publications that we've published. If you're dealing with, responding to homicide, Survivors Burial and Resource Guide, a step-by-step workbook for regaining control. Also, Always in My Heart, a workbook for grieving children. One of the things that I'm doing now is really bringing this modality of peace play in urban settings to life. September 21st, which is International Day of Peace, we will be hosting a community-wide virtual peace play. Don't know how it's going to work because it's the first time. What we will also be doing is donating peace play kits to individuals and families. So again, being able to be the architect of your own life. So we'll keep you posted to see how that goes. But this is the first time trying it from a virtual setting. I do it with individuals, but I've never done it within a community. So we'll see how it goes.
Thank you for that. Thank you.
I'm actually I'm in the South Shore. So I work out of a center called Hope Floats, which mostly is dealing, it's lost groups. We are currently going into the fall, probably in October, we'll be having a lost group for healthcare providers who have dealt with patients during the COVID phenomenon early this year. So thank you.
Well, I would like to again offer my serious thanks, for again your time here this evening. I learned a lot, and I hope that our viewers learned a lot as well. I think there were some excellent resources that were provided, so please just follow up. And again, I would like to emphasize that these resources aren't just for people that are based in the Massachusetts area. So wherever you are, please look into the information that was provided verbally this evening. I'm going to pass the floor on to Brenda, so she can take it away.
Thank you, Christina. Thank you to all of our amazing speakers. I'm overjoyed by the expertise that was shared. I think there is a very special, how would I say this, effect when there's personal stories shared. And I really appreciate all of the vulnerability, Vedna, that was shared this evening from our speakers. And for all of you guys who are watching, thank you for tuning in. I want to say this, that on Wednesday, please tell everyone who are not familiar with the English language or not comfortable, we're going to have this same session in the Haitian Creole language. So like Clementina was saying, teaching the older generation, we're coming for them too. That's on Wednesday night, okay? So you guys got to let them know we're going to be here same time, 7 p.m. to 8:30 p.m. in the Haitian Creole language, having other guest speakers in our community that are fluent in the Haitian Creole language to help our older generation and get us on the same playing ground, okay? As for HAMA and all these wonderful speakers, you guys, all of these wonderful ladies, their bios are on our website. It'll be there through September 23rd. If you felt like you couldn't catch anything and you wonder what the spelling was, if you go on our website, you will find everything that they just talked about in terms of their platforms and websites and Instagram pages, so you could follow them as well. I thank you again, and thank you for everyone for tuning in. I know we are the Haitian American Medical Association. We are the Haitian American Medical Association, and we are ending this thing early, 5 minutes early, okay? And we're doing it, right? We're doing it. So thank you, ladies. I really, really, really appreciate you guys. For those of you guys who are going to tune in again, I'll see you, or I'll see your mother, your father, your grandfather, your grandmother, or your aunt or your uncle on Wednesday night at 7 p.m. Thank you, everyone. The Haitian American Medical Association. Trauma. Keep the conversation going. Thank you.
Thank you.
Thank
Have
you.
a blessed evening, everyone.
Thank
Bye,
you.
everyone.
Good night.
Good night.
Good night.
Take care.
Good night.
Bye-bye.